And we're going to finish out with just a kind of unique thing that you will occasionally see in pediatric trauma, rarely, but the person who comes in saying, I got struck in the center of the chest and it hurts like crazy. So a posterior sternoclavicular joint dislocation is something you can get with those kind of impacts. We've seen a few in hockey players who had
a week ago.
Oh yeah. Okay. So body checked to the clavicle, and the clavicle goes backwards, and that joint surface is interrupted. Also, going into a steering wheel is another thing that can do it. So it's about as easy as you'd imagine. You know, everything's going to be swollen and tense, and so palpating for the junction of the manubrium and the clavicle becomes more difficult. It is a test you can use for this condition. You can just palpate, but the patient's going to scream at you as you push, right? So I'll skip those images for a second and just say, you know, an X-ray would basically look something like this, and a CT would show you that there's this displacement between where that head of the clavicle is supposed to be. And it's as easy as kind of putting a probe over and saying, I think those two surfaces of the manubrium and the clavicle should line up. And sorry for the quality of this picture, but here we've got those surfaces lining up. Here's the manubrium, a little bit of the joint space, and then here's the clavicle. And here's the manubrium, and here's the hematoma, and here's the clavicle displaced downwards. Okay, so that is actually all we have for joint. As I said, we're hoping that the next time we do this talk, we build it out and make it even more robust. And so I'll turn things over for any questions for people, first of all, joining us on YouTube on Google Hangouts. Comments, questions?